PKD is short for polycystic kidney disease. The cause of PKD is mainly genetics. We don't really know how it originates, but we know that about 50% of the kids that a patient has that has PKD will get PKD as well. The scary thing about PKD is that it usually doesn't show up until about mid-40s, and so they might have had all of their kids that they plan on having in their lifetime, and then they find out that they have PKD, and all of their kids end up, or half of their kids end up having PKD as well. That's why genetic counseling is huge with PKD. If somebody finds out that they have PKD, usually they'll talk to their kids about the chance of their grandkids getting PKD. I've heard lots of different people, I've heard a case where people just decided to adopt instead of have their own kids. And then I've also heard of a case where people decide to have 16 kids so that and raise them as the kids that get PKD will get a kidney transplant from the kids that don't have PKD. Just kind of whatever the patient wants to do. The pathophysiology of PKD is massive kidney enlargement from cysts that form in the kidneys. Those cysts are usually filled with, they can be filled with blood, pus, or just any kind of fluid, and those cysts cause kidney damage. They destroy the surrounding tissue, and that's why we've got some of these different assessment findings that we see. They're going to have an increase in blood pressure because the kidneys just aren't able to filter as well. They're going to have flank pain, obviously, because their kidneys are enlarged and they're super inflamed. They're going to have the enlarged kidneys, again, hypertension and edema, because all of that fluid is being held in rather than being excreted through the kidneys because the kidneys are failing. They've got hematuria. Signs and symptoms of UTI, such as like fever and chills, and they can't even get a UTI because they've got this warm, bloody area where this fluid is just kind of sitting in these cysts. It's just kind of asking for bacteria to come. And then we've also just got general malaise, which is just a feeling of blah all over. So some different medications or nursing interventions that we might expect to see the doctor to order is that we need to know what to do ourselves. First of all, we'll see we need to prevent UTIs in these patients. We want to avoid any infection that might cause their kidneys to work even less. Especially, we want to maintain kidney function as much as we can. We're going to want blood pressure medications to kind of avoid hypertension because of that excess fluid retention. And then we want to have a sodium restriction. We don't want to increase their blood pressure even more. Lots of people are kind of confused about increasing fluids, why we would want to do that with PKD if they've got blood pressure problems. The reason is because if we increase fluids, it helps kind of clean out those cysts and it helps maintain function, kidney function even more. Eventually, though, these patients are going to have dialysis or a transplant. PKD isn't a very good outlook. Lots of times they end up removing the kidney just so that they can not have that enlarged kidney in them. We even see some kidneys that are as big as a football. So with these patients, it's the big things are genetic counseling, teaching them that their kids, 50% of their kids have a chance of getting PKD. And we also need to teach them that it's going to end up in either dialysis or transplant, and that we want to maintain kidney function as much as we can.